Thank you, Chairman, Ranking Member. Welcome to our guests. Where to start? I think that we have today before us a 90 to 10 issue. Maybe it's 95 to 5 Americans concerned about the cost of health care. Since I got here 4 years ago, Senate, I've talked about the pillar of transparency, more innovation, and consumerism, letting patients be consumers again. So it's wonderful that we get an opportunity to address solutions. We've all described the problem. Now let's talk about solutions. Very proud of one of our signature legislation we've been working on for 8 years, Patients Deserve Price Tags Act. I appreciate Senator Hickenlooper's support, Senator Hassan, Grassley, he, and Ernst, their support as well. Could you imagine walking into a grocery store, going to the meat department, and not seeing the prices on the different meats? Could you imagine going to a clothier store and not knowing what the prices are on the suits? Most of us, we walk up there, we look at a suit, what's the first thing I do? I look at the price of it. But in healthcare, they've buried the prices. So what our legislation attempts to do is to give price tags on healthcare. What a novel thought. And I'll try a couple thoughts what our bill does and get your reaction. Ms. Deacon, I'll start with you. As a consumer, you have a choice of getting your hip replaced at one facility for $10,000, another one is $50,000, and that's not unreasonable numbers to compare a hip replacement 10 versus 50. How would you as a consumer, how would that impact the eventual cost of health care? If you're in a self-insured plan and you're running that plan, could it impact your decisions to drive down the cost of health care?
I mean, as a consumer, absolutely. If I had out of pocket, I would both evaluate for quality and cost to determine value, and I would likely find myself at the $10,000 clinic. But as an employer sponsor, if all of my members were to have such information, it would dramatically lower the cost of premiums every year, especially for our self-insured employers. Because more consumers would be able to evaluate such choices.
And this is a wild guess. Could it drive down the cost of a health insurance for an self-employed fund 10, 20, 30, 40% perhaps? I mean, it's a big number.
Yes, we've absolutely seen employers that are able to do that save 30 to 40% on premiums.
Exactly. Okay, Dr. Ippolito, did I do that right?
Yes.
Okay, Dr. Ippolito. Another component of our bill ensures that group healthcare plans have access to their own claim data. Can you believe it? I have a self-insured plan, and I can't look at my own claim data. Would that be helpful to us, specifically a self-insured plan?
Well, sure. I mean, at a minimum, if you're sitting there trying to think about what services are we going to use next year, what kind of plan looks good for us, if you don't know what services you use, you can't do that. And so in terms of those basic tasks that your employer, who's your agent in this world, for many of us, is tasked with providing, they need that information. So yeah, it seems like a baseline, a prerequisite.
So is there anyone on the panel that disagrees that price tags could not be helpful in driving down the cost of health care? Does anyone want to counter that argument? Okay, good. I want to turn to delinking just for a second. Of course, talking about pharmaceutical PBMs, right? Very horizontally, vertically integrated. Three companies controlling 85% of the industry. And many of you talked about the oligomonopolies that they're forming here. Specifically, Senator Kaine and I have a bill called delinking. And it delinks the money the pharmacy benefit managers make from the cost of the drug. So PBMs create formularies that really prevent you from using the generic drugs at less cost. They push you to the more expensive ones. So I'll start with Mr. Potter. Would reforms such as delinking PBM compensation from the list price of medicines benefit patients in meaningful ways and drive down the cost of drugs?
I absolutely agree it would. I think it's very important legislation. I think there should be delinking. That game, I think, incentivizes drug companies to have a higher list price. And then the middleman that you're showing that they're on that board are sucking so much money from the pharmacy supply chain. When I was at Cigna didn't own a very big PBM. It bought Express Scripts recently, a few years ago, and now it is largely a PBM that also has insurance plans.
Yeah, quickly, Dr. Miller, what abuse to patients do PBMs fulfill? Why are they in this food chain?
So I think that the PBM is a constructor of the formulary, right? There are over 20,000 prescription drugs. You know, us as physicians, there's no way we're going to remember that.
Is it, how does it help patients? Could we do it, if we remove them from the food chain, wouldn't we be better off?
I actually don't think so, because I think we want someone besides the government making decisions about.
It doesn't have to be the government. Okay, I appreciate the answers. Thank you, everybody. Thank you.